Well, let me go to the bill since the speaker is prematurely cutting me off.
To the bill.
I met a very nice lady at a pancake breakfast in my district. And when she and I talked, I asked her, "Are you vaccinated?" She said, "Yes." I said, "Do you think other people should get vaccinated?" She said, "Yes." I asked her, "But do you think kids shouldn't be allowed to go to school unless they get vaccinated?" And her answer was, "Oh, no." I asked her, "Do you think government should be forcing people to get vaccinated if they refuse, or if it violates their right of conscience, or that their employers should be forcing that?" And she said, "No." She intuitively understood what over 53,000 people and counting who filled out witness slips against this bill are trying to tell the governor and this legislative body. Government is supposed to persuade, not force. Government is supposed to respect and protect our civil liberties, not disregard them. And that is because we are citizens, not subjects. If we're going to say that there are healthcare services that are so important that we need to mandate them, spit it out, say it plainly, and enact it into law using the regular legislative process. And then every single one of us can be accountable to the people back in our districts for the vote that we took. What we don't do is destroy the separation of powers. Let an executive order or even an executive threat become the equivalent of the legislative process. And then take away the very remedy that the little guy, the powerless, the poor, the people have against government, administrative, and corporate overreach when it comes to medical rights of conscience. Let's also be clear that in this state, this is an unprecedented effort to backdoor a vaccination mandate without any lines of accountability, including at the legislature, and without any escape valve for religious liberty. Every other vaccine mandate we have in the state of Illinois is specific, limited, was passed by the legislature after years of conclusive scientific proof of beneficial outcomes, and they all still allow for religious exemption or independent proof of immunity to satisfy the statute. You haven't even offered a reasonableness or scientific efficacy standard for what you're doing here. If you were being scientific, you'd be testing everyone in, for example, congregant care facilities. Because according to the September 16th, 2021 New England Journal of Medicine, vaccinated healthcare workers with breakthrough infections, even though they may have had mild symptoms, they had high viral loads and had prolonged viral shedding for up to 32 days after diagnosis. But the governor is not saying that even in his state facilities, he's not making those people test. So much for following the science. This legislation is designed to lead to absurd results where you can let an employer or any person employed by any unit of government in the state of Illinois force a person to do things, even things your doctor thinks is medically contraindicated, wrong, or harmful. And tonight, your yes vote means you've denied them a remedial claim. They get nothing in a court of law. That is contrary to the legislative intent of our Right of Conscience Act. I urge a no vote.